Now we shall be looking at typhoid fever. Okay, so basically it is caused by Salmonella typhi, Salmonella paratyphi. There could be asymptomatic carrier state also. Patient may present with gastroenteritis, enteric fever. The onset of fever is typically it is gradual, continuous, and temperature might go up to 40 degrees Celsius. So the patient might also complain of malaise, anorexia, lethargy, and headache. Constipation or diarrhea might also be a presenting complaint associated with abdominal pain and tenderness. Pea soup stools might be one characteristic feature. Hepatomegaly, splenomegaly may be observed. So, hepato and splenomegaly. Okay. And we can also notice complications like hepatitis, meningitis, pneumonitis, myocarditis after the first week. So first, what will we do? Yes, investigations. So investigation, Vidal test. Now there is raising of O antibodies. Now it is confirmed by isolation of the organism in blood, bone marrow, urine, stool. Okay, any of these samples can be used to confirm the organism. Now we go for the pharmacological treatment. If the enteric fever is uncomplicated, the patient might as well be managed at home with the antibiotics and antibiotics. Now, if at all the patient has complaints of vomiting, diarrhea, abdominal distension, then hospitalization admission becomes important, along with supportive therapy. Now, I'll be telling you what drugs can be used. Therapy should be administered for at least 10 days or 5 days for 5 days after the fever is resolved. So first we'll be discussing about the empirical treatment. Empirical treatment will be using ceftriaxone 1 to 2 gram per day, route IV. For how many days? 7 to 14 days. That was the empirical treatment. Now when the patient is fully susceptible, first line we can use ciprofloxacin. How much? 500 mg BD per oral or 400 mg BD IV. Okay, for how many days? 5 to 7 days. First line. Second line, amoxicillin 1 gram TDS per oral or 2 gram QID IV. For how many days? 14 days. So you can remember this. Empirical 7 to 14. Ciprofloxacin 5 to 7 days. Amoxicillin 14 days. So multiples of 7. Again, chloramphenicol can be used. 25 mg per kg TDS per oral or IV. Again a multiple of 7, 14 to 21 days. Okay. Next one will be trimethoprim with sulfamethoxazole. So that would be 160 trimethoprim. Sulfamethoxazole 800 mg BD per oral. Again multiples of 7 to 14 days. If the patient is multi-drug resistant, so we can use ceftriaxone. Okay, ceftriaxone 2 to 3 gram per day. Okay, route IV. Again a multiple of 7 for 7 to 14 days. Next, azithromycin 1 gram per day per oral for 5 days. Other third generation cephalosporins is cefotaxime 2 gram TDS IV or cefixime 400 mg BD per oral. Instead of ciprofloxacin, ofloxacin can also be used 400 mg BD per oral for 2 to 5 days. That's it about typhoid. Thank you.